Alright, I verified the doctor's orders and that Mr. Smith needs nasopharyngeal suctioning, so I have my supplies. So now I'm going to go into the room. Hello, I'm Emma. I'm going to be your nurse today. Can you tell me your name and date of birth?
John Smith, 10/29/76.
Alright, sounds good. Alright, so I'm here to perform some suctioning on you. So first I need to do an assessment on his lungs. On your lungs, is that okay?
Yes.
I hear crackles both sides of the lungs, so he has a need to do nasopharyngeal suctioning. So I'm going to raise the bed to a comfortable working height. I'm going to raise the head of the bed to 45 degrees. I'm also going to explain the procedure. Have you ever had nasopharyngeal suctioning, Mr. Smith?
No.
No? Okay, so what it is, I'm going to stick this catheter down your nose and in your mouth to get out any secretions. It's not going to feel too uncomfortable, but I'm going to be here with you to keep you all comfortable. Is that alright?
Sounds good.
Alright, I have his towel on in case if he throws up. Alright, I'm going to put on my goggles. And then I have my kit right here. I'm going to open it using the sterile technique. I'm also going to take out, put it on the floor, have my stuff. I'm going to open it, and at this point, it's going to become sterile, so I got to be careful with all this. There is sterile gloves in here, but I'm not going to use them because they're not my size. I also have lubricating gel. I'm going to squeeze that into the sterile field. And at this point, I would don my sterile gloves. Actually, no, I'm not. Hold on. I'm going to turn on the suction to 100 millimeters of mercury. I'm also going to hyperoxygenate the patient. So if I take off his O2 sets don't drop when I take it off. At this point, I would put on sterile gloves. And before I would put on the sterile gloves, I would perform hand hygiene as well. But since I already put them on, I would make that correction. Right, now that my sterile gloves are on, that's going to go on the floor. I'm sterile now, so I'm going to pick up my sterile basin and open it. Just going to set it right there. This is sterile. I'm going to open the sterile solution and pour some in. And then I would, if this was pre-opened, then make sure it was used within 24 hours, and then I would date and time it. Okay, I'm gonna get my suction catheter. I'm gonna wrap it around my hands. Okay, I'm gonna bring my station closer. So this hand is gonna become unsterile now. I'm gonna connect it to the catheter. And then this thumb is going to control the suctioning. Okay. Mr. Smith, I'm going to take off your mask again and we're going to start the procedure, all right?
Okay.
All right, so I'm going to use this hand, take the mask off. And then I'm going to unravel this. I'm also going to try and measure as well. So you're going to go from the nose to the ear and then down there. So it's going to be like 18 centimeters-ish. So what I'm going to do is I'm going to test the suctioning in the water. And it's good. I'm going to use lubricating jelly. to lubricate it. All right, we're gonna start. Mr. Smith, you ready?
Yes.
All right, so I'm gonna insert in the nose to the 18. I'm also gonna twist into that, into my mouth, put the oxygen back on. I'm going to test it again. All right, lubricate again. I'm going to take off the mask again, and then this time we're gonna go in his mouth. All right, you ready again?
Yep.
We're gonna go in the mouth. Just go in, and then slowly withdraw, making a twisting motion. All right, put the mask back on. And then that would be, the procedure is concluded. I would wrap this back up, disconnect it, turn off the suctioning, and then I would discard all my supplies. And then I'm also going to collect the towel. This to go with linens. I would take off my sterile gloves. I would take off my PPE as well. Perform hygiene again. And then I would reassess the patient. Did that go okay, Mr. Smith?
It was great.
Okay. Alright, so lung sounds are clear now, so the procedure was effective. I would lower the bed, and then I would also turn down the oxygen back to what it was at before. I'm gonna lower the head of the bed a little bit. Do you want me to keep the head of the bed a little bit up?
Yes, please.
All right, we'll just keep it right there. Move everything to the right station, and then I would document how the procedure went, and if I got any secretions, what the color was, if the odor of it, if possible. And then I would document how Mr. Smith felt about it, if there was any complications or abnormalities that I found. And then I would finish cleaning up my mess, not my mess, my supplies. And then that would be the end of the procedure.